Allyson. I'm a physical therapist. I work at CORE Therapy and Pilates. And before I worked here, I didn't know a lot about Pilates. My sister was a professional ballerina for 14 years, and she was required to do Pilates as part of her ballet career. But I also noticed that it was a billable code on a medical billing sheet, and that was it. I have been doing physical therapy with people, getting them out of pain, getting them into some of the activities they want to do, but once they are able to do their job and function, they were gone, and they'd probably be back because the old habits would not die. So I would try to educate people on the way they walked, the way they stood, and their posture, and give them the tools they needed to know what they needed to do to not get injured again. But people don't follow through with that kind of stuff, and they certainly don't follow through with it when they're not seeing you, and it's 4 months after, and they're still doing fine. So you'd see them again later down the road. Didn't know how long, but they'd be back. And I've taken a lot of great education for physical therapy, continuing ed things, on postural changes, on back courses at different stages in life, and functional exercise. They're great. Again, they're sort of limited, that you have this window with people, and then it's all over. And they didn't usually, you would put people's bodies in this position you wanted to be in, and they could get there, but they won't maintain this 2 hours later. So that was frustrating. But with the Pilates certification process, I've been able to teach people some basic Pilates, essential exercises, some basic mat work, things they could do on their own at home. There's a lot of different Pilates co-contractions and things that you learn that will help people, but it's a baseline for them, and then they can go, once they know how to do it and you can see them, they're doing it correctly, they can go out and take a Pilates class or take a Pilates private session, and reinforce some of these things. They're not seeing a physical therapist, they're not getting their insurance, to pay for it, but it is a way for them to inexpensively go and reinforce all the things you've taught them, so they do change their posture, they change the way they walk, they change the way they sit in their office, and can stay out of pain forever. So as a physical therapist taking the Pilates teacher training, it helped me to give people a baseline of good Pilates technique, and then give them all the tools they needed to continue some of the great changes we've made in therapy. So it was a long-term solution for people. The thing I like best about it, though, is what it did for me personally, and all the different Pilates pieces of equipment that I learned about were great, but the form and the technique that you learn, that I then sit better. I am doing all my chores at home better. I'm running with much better form. Everything posturally and structurally is better just in the way I live. But I've experienced it. It's changed me in the way I do things, and so then I can have that experience to share with clients and give them a vision for all that change that can happen over the next 6 months, year of doing the work and practicing those techniques. So it also helps you as a physical therapist, though, to be able to use and help other people learn how to use core muscles during all movement, any activity anybody ever wants to do. It helps you to recognize imbalances when you're doing the work. It's so easy to see weaknesses or imbalances, between front, back, or one arm, another, in between lower extremities or upper extremities. It's just easy to recognize, and to give clients confidence in their ability to use these techniques you have taught them, and then go move on top of that in Pilates, and then continue the work on their own in classes, so that they are fully recovered. They are back to their normal activities, but even better, they're back to their normal activities with better form, so they're not going to get injured again, with a better understanding of how to use their core, so they're not getting injured again, and then a way to practice that every week, every month, however often they need to make the change and make it stick. So that's why I really enjoyed and have been really changed by the Pilates teacher training.